8:23, welcome back in. June is Pride Month, and while there is plenty to celebrate, there are also real health challenges LGBTQ plus people are facing. Many delay care or avoid doctors altogether because they don't feel safe or don't feel understood. Joining us now is Dr. Efrat LaMandre, also known as Dr. E, a nurse practitioner, LGBTQ plus health advocate, and major voice online to break down everything that needs to change. Good morning to you. We appreciate your time. Thanks for being with us.
Thanks for having me.
I want to start with just some of the most common health issues in the LGBTQ plus community that often go overlooked.
Sure. So the LGBTQ plus community is more likely to suffer from chronic stress, anxiety, and delayed diagnosis all around. And that's because it's stressful to be in a system when you're not always welcome. It's not that they're inherently anxious or inherently unhealthy, but the stress of navigating a system that often doesn't see them or hear them, and that fear of being judged or misunderstood leads to avoiding care, which leads to delayed diagnosis and conditions that could have been prevented.
And talk about the risk of that and what delaying care, can often lead to.
Sure. So delay in care in general, this is true for anyone that delays care, means that by the time you're diagnosed, things are already more serious or more severe, because a lot of medicine is about preventing things or catching them early. So if anyone's scared to go to their medical practice or just feels, it's just uncomfortable, that kind of bracing themselves before they go, then they're less likely to get the attention they need early on.
And talk about affirming care. We hear that term kind of thrown around a lot, but what does it actually mean to have that, and why is it so important?
Sure. So affirming care means precisely that you don't have to brace yourself before you walk in the room. It's care that you don't have to explain who you are or correct yourself, correct the provider 3 times. It means your identity isn't treated like a complication that has to be managed. You get care that fits your body, your risks, your reality, without having to constantly filter your words. And it starts the moment you walk in the door, the signs, the intake forms, the staff training, the providers. And it's about care that validates you from the moment you walk into the building.
And we know how important it is to feel safe, to feel seen and heard when you visit a doctor's office. What can we do to be a better ally to LGBTQ plus community members, patients, right, to make sure that they are having that same experience?
I love that. Allyship isn't about big gestures. It's really the basics. If your friend is nervous about going to a doctor or medical procedure, go with them. If someone gets interrupted or dismissed, help redirect the conversation, right? Calmly and gently. And if you hear someone joke or judge, say something. Again, it's not about big gestures. It's about noticing what others maybe are overlooking and taking small steps to correct.
Really important there. Of course, I know there are, of course, a lot of resources online. Where can people find you and find some of those resources where they can maybe learn how to advocate for themselves or for someone else?
So for resources, usually the local Pride Center will list a lot of the medical practices that have identified themselves as a safe space. So go ahead and try that. If you're looking for me, it's at drefratlamandre.com or my podcast, The Medical Disruptor.
All right, lots of great information. Dr. E, thank you so much for your time and your insight. We appreciate you.